Colorectal cancer is the second leading cause of cancer deaths, both in men and women. This is because it can be hard to detect in its early stages. However, when found early, the recovery rate can reach an impressive 90%. Detection can be done by observing the symptoms and signs of the disease, as well as through screening tests under the guidance of a doctor. Hello, I'm Dr. Marcos, and welcome to the You Stronger channel. But before I share this important information, please take a moment to subscribe to the channel and give this video a like. Your subscription and like will help this video reach as many people as possible. Can I count on your support? You might be wondering, what exactly is colorectal cancer? Colorectal cancer is a disease that affects the colon and/or the rectum. To understand better, let's take a look at the gastrointestinal system. The intestine is divided into two main parts, the small intestine, which is the blue part, and the large intestine, the yellow part. The large intestine is made up of several sections, such as the ascending colon, transverse colon, descending colon, sigmoid colon, and finally, the rectum. This cancer can affect any part of the large intestine or rectum. So, what increases the risk of colon cancer? There are various factors that can contribute to the development of the disease, but the most important one is age. As we get older, the risk of developing colon cancer increases. Other factors include inflammatory bowel diseases like Crohn's disease and ulcerative colitis, a family history of colorectal cancer or intestinal polyps. Around 5% of cases are caused by genetic factors, such as familial adenomatous polyposis and Lynch syndrome. Additionally, certain lifestyle habits can also raise the risk of developing colorectal cancer, like a diet low in fiber and high in fats, a diet with few fruits and vegetables, lack of regular physical activity, and alcohol and tobacco use. Now, let's talk about the signs and symptoms of colon cancer. Changes in bowel habits, such as persistent constipation or diarrhea lasting more than a few days, can be a warning sign. There may also be difficulty fully emptying the bowels, and it's common to feel discomfort during bowel movements. These symptoms are often related to less serious problems, but they can also be signs of colon cancer. If these symptoms occur in people over the age of 50, they could be a warning for colorectal cancer. You might also notice that your stool is narrower than usual or has a different shape than normal. When there is an obstruction, the path for the stool becomes narrower. In this case, the stool must pass through this tight area, which can change its shape. Sometimes, the shape of the stool can resemble that of a pencil. The size and shape of the stool vary depending on the size of the tumor. Bright red blood or blood in the stool, which can turn it dark brown or black, may also be a sign of colon cancer. Other health issues can cause bleeding in the digestive tract, but if you start noticing bloody stools, it's crucial to see a doctor right away to rule out a more serious condition. Remember, this is one of the most common signs of colorectal cancer in its early stages. Also, be alert to any pain in the rectal or abdominal area. You may also experience pain from gas, stomach cramps, or a constant feeling of bloating, even without having eaten recently. Abdominal pain in colon cancer can happen due to a partial or complete blockage of the intestine, or from the cancer spreading to the membrane that surrounds the abdominal organs. Another important sign of colon cancer is unexplained anemia. This anemia is caused by chronic blood loss, which reduces the number of cells that carry oxygen in our body. If you're anemic, you might notice feeling tired, weak, and fatigued, which improves with rest. Another indication is the presence of a palpable mass in the lower right side of the abdomen. To understand this better, the abdomen is divided into 4 quadrants. Now, let's break down the abdominal division. We have the upper right quadrant, the upper left quadrant, the lower right quadrant, and the lower left quadrant. If the tumor is located in the lower right quadrant, it may be palpable in some cases. Another important sign is tenesmus, which is that constant urge to defecate and the feeling that the bowel movement was not complete. Other potential signs of colon cancer include unexplained weight loss, meaning you lose weight without trying. Another symptom is vomiting, which may occur due to an intestinal obstruction and reduced movement of the gastrointestinal system. Some patients may also experience a fever. Now, let's discuss the signs and symptoms when the disease is more advanced or when the cancer has spread to other distant organs. The cancer can spread to the liver via the portal vein, which may cause liver enlargement, hepatomegaly, and symptoms of jaundice, such as yellowing of the skin and eyes. It can also spread to the lungs, leading to breathing difficulties. Additionally, it can affect the lymph nodes, causing lymphadenopathy or enlargement of the supraclavicular lymph nodes. However, in most cases, colon cancer doesn't present symptoms until it has already developed or spread. That's why it's essential to undergo screening tests even before showing any symptoms, especially if you have a family history of cancer. When colorectal cancer is diagnosed early, through tests before symptoms appear, it can be easier to treat. Screening can also prevent colon cancer because it's possible to find and remove early changes called polyps, which could eventually become cancer. I hope this video has helped you. Share it with a friend or family member to spread the knowledge. Don't forget to subscribe to my channel, as it will help this content reach more people around the world. Thank you very much.
Legal disclaimer. This video is for educational purposes only, aimed at instructing the public on various topics related to medicine and general health. The information provided in the videos is not intended to replace medical consultations or serve as recommendations for any treatment plans. If you have any questions, please consult your doctor. Medicine is a constantly evolving field, and the videos are based on the most recent scientific articles available at the time of production. The videos are strictly for educational purposes only and do not disclose addresses or phone numbers of any office, clinic, or service.